You recently rewritten your book called Disc Schmiss.
Yes.
Did I say that right?
Yes.
And so talk about disc Schmiss and your disc theory.
Well, again, here's the truth on discs. The disc, the herniated disc, it can herniate to the right. It looks like it's pinching the nerve going down the right leg. But guess what? Pain goes down the left leg. These herniated discs, they routinely shrink or disappear on subsequent MRI, all on their own, yet symptoms remain. There are people with no herniated discs, yet they have chronic radiating nerve pain to the foot. There are people with herniated discs, never had a back pain in their life. It is not a question, it's a conclusion. In medical literature, there is no correlation between discs and back pain. Again, we're stuck there for 3 reasons. Symptoms don't feel like a muscle, no apparent spasm, what can you say when it becomes chronic, fails to resolve with element or muscle therapy. We're left scratching our heads. We know the hard evidence makes no sense, but what else could it be? That's where the world is stuck right now.
So you say that discs kind of bulge and then shrink?
They bulge, they shrink, they disappear. Yes, I had a young man who had a herniated disc that was nearly occluding his entire spinal canal. And surgery was deemed imperative. Workers' comp refused to pay for it. He goes to the workers' comp doctor. He says, the doctor says, it's my job to defend workers' comp and say you don't need this, but I agree with your doctor. You have one of the worst MRIs I've ever seen. You could sneeze and go paralyzed for life. You must have this surgery. Who would question this? But this young man was a genius. And before having a major back surgery at 30 years of age, he insisted on and got a second MRI. He goes back to his original doctor for the results in the second MRI. On the second MRI, the disc in question disappeared, looked completely normal. And his doctor greets him, says, "Congratulations, you must be feeling better. Surgery is no longer necessary." He says, "Really? To be honest, I still feel the same." This is the thing, they present these things like they're fact, but they're not a fact, and they just don't know any better.
So discs don't pinch nerves, but muscles do?
Those discs
Talk about
that
pinch
look,
nerves.
yes, those nerves in your spinal cord are not as vulnerable as they appear. They are rather more like our own electrical cords, that you can step on them, but it does not interfere with the current going to the lamp. Again, that disc is an innocent bystander. It's been taking the blame for a crime it did not commit. The problem isn't the muscles, it's just that there's no apparent spasm, and barbaric massage does not work on tough cases.
Talk about what a spasm is and just explain what is an underlying spasm.
When you tweak a muscle, and the tweak can be very minor, in response to the tweak there's a reactive contraction in muscles around the injury. Now, the thing is that so often, there's nothing sticks out.
Do the muscles pinch nerves?
The muscles crimp on the joints, and those joint linings are lined with nerves, and that's why it feels deep. It doesn't feel, like a muscle. It's the muscles crimping on the joints that makes it feel deep. It feels real deep. It doesn't feel like a muscle, and that's why our intuition can play games with us.
Mm-hmm.
It was once thought only logical to assume that the Earth was flat. We now know it's round. It was once the scholarly thought to think that the sun revolved around the Earth. Now we know that the Earth revolves around the sun. So our own intuition is not always correct. It feels deep. It feels like a disc is pinching a nerve, and it is muscles crimping the joints. That's all it is. And when you relieve the grip of those muscles, all those symptoms go away.
So when people talk about shooting pain,
mm-hmm.
they're nerves. But are they pinched nerves by a spasm?
People forget that every muscle fiber is innervated by nerves. And so many times that radiating pain down the leg is following a spasm pattern of muscle. Because when I roll a portion of that IT band and they say that's it, that is not the sciatic nerve. That's radiating along a spasm pattern. And all that numbness and tingling into your calf, it feels like a nerve, doesn't feel like a muscle, but all it is aggravated underlying spasm there. And when you eliminate that by working the muscles alone, how can that be?
Talk about, just for a second, how the numbing out of pain, this whole process of numbing out pain. Sometimes you would work in an area and in that area wouldn't feel anything, but then after about 20 or 50 strokes, then all of a sudden something wakes up. Can you talk a little bit about that process and what is that, and what is this numbing out of your consciousness?
It's the aging process of your body. Again, muscles, they start out in life a plump, juicy hot dog. We slowly age into crispy bacon. And your muscles, they develop knots and ropes of clumped muscles, of clumped pasta. Those fibers, they clump together, and what your body does is it numbs spasm out of our awareness. So often, as I scan the body, I will put people in touch with spasm they had no clue existed, and they might not have any symptoms. But this is the normal aging process of the body. Your body numbs out spasm out of our awareness. And when you stroke them like a one-time deck of cards, you're going to put people in touch with things they had no clue existed. And some things that are numb, that are completely numbed out, you're going to wake them up. So there's every shade of gray between hot dog and bacon. Some fibers are alive and sensitive, some are dead and plastered. Some you're going to wake up, some are already super sensitive. And everything in between, we wake up the dead, the alive and sensitive ones, we're going to calm them down.
So it is a raking versus a mashing.
Yes, it's a one-time precision raking of muscle, always getting a very, done. This work is kind of like the golf swing. It's accessible to many. Now, to do it well, it's not as easy as it looks, but it is accessible to many. And because we don't overpress and we come at the proper angles and it's tapped into a deeper truth, even rookies will be amazed at the results they can achieve. Now, to do it at a high level, yeah, we're talking more precision, more precise. But there's a kind of a simple way to do it, with long oil strokes that are not so precise. But again, we don't overpress. We're coming at the right angle one time. And then, yeah. And then you can get more and more precise with it as you get better.
Mm-hmm. And talk about overpressing and what happens. Why do you not overpress?
If you press too heavy too long on a muscle, it tends to slightly to resist. Now you can take it, but you cannot fully recondition muscles if they're tensing to resist. And most muscle therapy right now, what they do is they just think they're going to melt spasm like a knife through butter, and they'll go, just breathe, just relax. Now what you're doing here with constant pressure like this, what you're actually doing is relaxing every other part of your body. There's a little bit of tension underneath constant pressure, and yeah, you can take it, but you cannot relax that. That is an autonomic reflex that is beyond your ability to control. And so that's why we use no constant pressure. We don't stroke back and forth with pressure. Everything is one time and off. One time and off. Angles and locations that give us the deck of cards, and you can feel it. And when you compare the two, you can feel how there's a little tension when you overpress.
Mm-hmm. And that method, deep tissue, that modality of massage has worked for people, and people have been fixed using that method.
Yes, because back pain is self-limiting. For most people, your body's going to make bacon, and it's going to be self-limiting. So many times, anything that helps numb out pain and spasm will seem therapeutic. And I can tell you myself, there was when my blade pain, I had blade pain flared up here, and I had one of those hooks, one of those acupressure hooks, and you just pressed on it, and it overrides the pain signals. Pressure overrides those pain signals, and it allowed me to sleep that night. But the next time I was worked on with AMR, I could tell how some of those fibers were clumped together. I used to do all those forms. I was raised on those things, and I know that there was a time in my life that I thought they were God's gift to humanity. The bottom line is they don't work on tough cases, and there are situations when overpressing makes people worse. So that's the problem with back pain. It can be confusing because so many things work sometimes. Pretend your muscles are a patch of grass. You can do log rolls on the grass. You can lean on the grass with your elbow. You can jump up and down on it. You could go over it with a steamroller. You could ice it, heat it, cut it, pet it, stretch it, talk to it, shine a white light on it. Can we all agree it has a different effect on the grass than if we simply took a leaf rake to it? Many treatments, they have the same intention, but they don't have the same effect. They have the same intention, but they don't have the same effect, and that's why they don't work on tough cases.
How come you don't speak in scientific terms?
To me, it's about communicating with, I talk with patients. And, the term doctor means teacher. And I speak with patients, so I try to speak in terms my patients can understand better. I mean, to me, naming the name of a muscle doesn't have a lot of value. Because to me, again, muscles, they all clump together, and what you're on is, it's only a theory what muscle exactly what you're on sometimes. And again, muscles on a chart, those are dissected muscles. We work from the outside in, and to me, it's all about a deck of cards. So it doesn't matter the name of a muscle. Do you have a good stroke? That's what's important.